Hi, this is Paul Wise and welcome to the Lawn Vet video series. Today in this short video we're going to be sharing some information about lumps and bumps that you may find in or on your pet's skin. Lumps you might find on your pet typically will fall into one of four categories. 1. Infection, so cat bite abscesses, cellulitis, foreign body reactions, tooth root abscesses, to name but a few. These tend to come up quickly and are often painful, and the patient may show sign of illness. Number 2. Inflammatory bites, such as insect bites, ticks, stings, urticaria reactions or allergic reactions, also known as hives. Number 3. Cysts, usually caused by the accumulation of a substrate produced by glands in the skin, examples of which might include a sebaceous or follicular cyst. And number 4. Neoplastic changes or cancerous growths, which can vary from the very benign to the extremely serious and life-threatening. What should you do if you find a lump or a bump? Put simply, I would advise you phone the surgery and make an appointment for your pet to be examined. All four of the above categories of lump might require veterinary treatment, and an abscess is likely to require lancing, flushing and antibiotics. If it relates to a tooth, then the offending tooth will need to be removed. Inflammatory lumps aren't generally serious, and many will go down if left. However, the danger is in differentiating inflammatory lumps from the more serious lumps. Cysts again, generally not too much of a problem unless they rupture internally, in which case they can produce a reaction in the deeper tissues called a foreign body reaction. The big issue once again is differentiating them from the more serious lumps. Neoplastic or cancerous lumps. As I said before, there are many different types, and even the same type of cancer can behave very differently in different patients. So I'm a vet. I qualified in 1990. I've been working in general practice ever since, and I've seen a lot of lumps in that time. Even with that level of experience, can any vet differentiate 100% of lumps 100% of the time just by looking or feeling them? And the simple answer to that is no, they can't. So the first thing I will do when you present your pet with a lump is to try and identify it and assess the history you've given me. I will look at its appearance and what it feels like when I palpate it. At this point I know I won't be 100% accurate, so then I will take the following points into consideration. 1. The history of the lump itself. How long has it been present for? How quickly is it growing? Your pet's previous history. Have they had any other lumps in the past? 2. The size and location of the lump in or on your pet. How easy is it to remove? What structures is it near that might cause a problem? How much skin is available to close the wound? 3. The age of the patient. The principal question here I'm asking myself here is the lump likely to cause your pet a problem within their life expectancy? Number 4. Any intercurrent diseases I need to regard with regards to anaesthesia or surgery? Number 5. Is your pet about or do they need to have another procedure to be performed which requires an anaesthetic in the near future? So for example, neutering, an investigation or another problem or disease, or maybe they need a dental. I will then discuss with you the various options. You could leave and observe it. We could undertake further diagnostic testing, usually a biopsy, and that might take the form of a fine needle aspirate or possibly a full surgical biopsy. Or lastly, we could surgically remove without biopsying. Lumps are, in my opinion, best dealt with on an individual patient basis. You cannot safely generalise as to their nature and behaviour, which is why it's a good idea for us to examine them. When I was at university, one of my lecturers used to say, lumps are like members of the opposite sex. You never quite know what they're like until you take them out. As always, if having watched this video you have any questions, or if you encounter any difficulties, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Thanks for watching, and any feedback regarding this video would be very much appreciated.